See, last class we spoke of Causticum. So Causticum we have already finished 2 sessions. The first session we spoke of on the ailments, the causative factors, and in the second session I had introduced something new, meaning we spoke of one segment of Causticum, meaning on nervous system we saw Causticum through the cerebrospinal system acting on the spinal cord, and then through the motor nerves it will cause paralysis. Paralysis is what we discussed in detail. Okay, so must be for the first time we explored paralysis under different headings. So what was the key points to recall in Causticum related to paralysis? Okay, single part, good, agreed. And it had a lot of ailments. Ailments as simple as exposure to cold, dry wind, okay, and suppressed eruptions, some emotional factors causing paralysis. Good. Then what else? Yeah, one side, right side, and yes, paralysis associated with coldness and numbness. Good. They were very, very vital. See, and again, one thing we spoke here was the onset of paralysis in Causticum was gradual. That was a very important point. And then we also tried to explore individually on single nerve, fine, or on single part, what exactly Causticum will do. From head to toe, we try to explore. Now this is a quick revision what we tried to do in the last class. Now we'll skip this so that we can concentrate. Yeah, see, we also compared, if you remember, like alumina, zinc,um, gelsium, and conium, plumbum, dulc, aconite, cocculus. Few remedies we had compared. Yeah, I'll skip this now. See, yeah, if you remember this last slide, this will give us the entire gist. Fine. So paralysis, what caused paralysis, what was the onset, the side affinity, what was the effect on each thing. For example, tongue, the bladder, the rectal muscles, fine. And what was the character of paralysis. We looked into that and then we compared. Now, see, continuing with the nervous system, though I will not go in so much of depth like we did paralysis, what I want to try to tell you is, Causticum, apart from paralysis, acting on the nervous system, it can cause few more things. It can cause chorea, it can cause involuntary movements, tics, twitchings, and it is also a very good remedy for locomotor ataxia. Okay, one of the top remedies. And you also have convulsions, and again a very important remedy for MS, multiple sclerosis. Fine. Now if we continue Causticum like we did paralysis, it will become very extensive. What I just want to try to tell you here is, so Causticum, the chorea, tics, twitching, locomotor ataxia, and other parts can also be explored in the same methodology. Okay. Now we'll focus on one more important area. Now when we say Causticum, we are looking at the physical generals. Okay. We have not yet discussed the mind part. Hopefully today we'll try to finish off the physical generals, and next class we'll try to take up the mind. Okay. Now other than the nervous system, the paralysis, convulsions, where else you see Causticum acting? Okay. And what could be the other areas that we need to explore? Very good, skin. Okay, and must be you also saw the picture of warts being displayed. Good. Now, so like we understood paralysis, extensively we'll try to understand warts. Warts in Causticum. As a practitioner tomorrow, when do we think of causticum in warts? Okay. When it is on fingers, very good. Very good, Dr. Sunil, Dr. Shweta. They have a point, fingertips. Fingertips, we'll discuss that. And when you have warts around the nail, okay, fingertips, warts around the nail. Now, how do we study warts? The question is, how do we study warts? Under what headings one can explore warts? Very good. One is location. Then, okay, how do they appear? Good. Appear. Okay, are they single or are they in groups, clusters? Good, agreed. And we can generalize that under one heading, and that heading will be character. Okay. So what I am trying to do is, I am trying to explain causticum warts under two very important headings. One will be the location. The second very important thing is, what is the character of warts that you have in causticum? And the third component we'll be discussing today is, we'll try to compare what are the remedies for warts and how do we differentiate, okay? And some cases in between. And warts, people very happily they come to a homeopath, because in allopathy warts they burn, they cauterize, okay? And from the word of mouth publicity, we know that homeopathy has got beautiful remedies, very effective remedies for warts. So, moving ahead, the first part is location. Now, this is also a very important area. Each remedy will have an affinity to produce certain things in certain areas. Okay. So, location will become very important. Now, when you look at the location, where do we see warts in causticum? Two areas your friends have already contributed. One was the fingertip, typically the fingertips, and the second thing is it can be around the nail. Two areas. Any other area that you can recall? Eyes, very good. The entire eye? Eyelids, good. Eyelids, okay, good. Eyelids. You can also have warts over eyebrows. In causticum, warts over eyebrows, warts over eyelids, going down anatomically, keeping the anatomical position in mind. Where else can you think of warts in causticum? There is one specific area, and this area, no other remedy has warts. This is the only remedy, and that is at the tip of the nose. Warts at the tip of the nose. Okay? So, when you talk of location, we miss one more anatomical area here. You also have warts over scalp. Warts over scalp. Any other remedies that you can think of which has warts over scalp? Tuja, you will be seeing here everywhere. It's an anti-psychotic remedy. Okay? See, now the beauty is, all cases of warts, Tuja will not work. Why? Tuja has its own characteristic warts. Similia similibus curantur. So when only the Tuja warts matches with that of the patient, Tuja can do wonders. Okay? Fine? But here, three remedies you should keep in your mind. One is calcarea, the other one is creosote, and the other remedy I am discussing here is sepia. Warts over scalp. And one more remedy I want to highlight here will be calcarea floor. Hard warts over scalp. From your UG knowledge, you know calcarea floor is a very important remedy which has hardness. So when you have hard warts over scalp, one remedy that should come to your mind is calcarea floor. Okay. So eyelids, you just told me, eyelids there are plenty of remedies. Warts over eyelids. I will not appreciate if you tell Tuja. Fine. Any other remedy apart from Tuja? Huh? Okay, cephysagria, better remedies. Warts. And I will just give you a small clue. In this remedy, the warts will bleed. Okay, very good, nitric acid. So, Tuja, nitric acid, calcarea carb, cinnaberis, and two very important remedies from magnesium group, mac carb and mac salt. Okay, what's our eyelids? And now this is the image that I was trying to share with you, taken from Google Images. What's our tip of the nose? Only remedy is Causticum. Don't forget. Okay? What's our nose? Causticum in general. But what's our tip of the nose? Causticum is the only remedy. Okay? Now the other remedies, I wanted to share two rare remedies. Rare means, at least for me it is rare. I don't use them very often in my clinic. One is manganesium and laurocirrus. At least laurocirrus we have heard and we have used, but manganesium is a remedy that I have not used. But what's over nose? You can think of that remedy. Now what's our face? What's our face? Again you have Causticum. Okay. Now the other remedies, Tuja, nitric acid, calcarea, carb, sepia and calicarb. Okay. Now what's our eyebrows is what we were trying to understand. In this you have Tuja, nitric acid and anacardium. See, they are all there in your repertoire. Okay. What's our hands? What's our hands? Now where do you have dulcamera? Dulcamera has a specific area. And if time permits, we will try to understand the character of warts in dulcamera. And dulk is a remedy, never forget, which will have warts on dorsum of the hand. Okay? Dorsum of the hand. And exactly opposite will be natremure. Many remedies have natremure. And one case I had shared. One lady had almost some 30-40 watts. I have the images also. 30-40 watts over fingers. Okay. Now in your repertorial totality, it is very important the remedy should cover watts over fingers. Fine. See, and everywhere if your body is producing some growth, it will have some thought process behind. That you need to understand. Okay. Now one lady had given Laccan. The only 3-mark remedy in your repertoire which has warts over fingers. And this lady had a lot of issues with her confidence, and she had strong fear of snakes. Even to the extent she can't watch it over TV, magazine picture she can't see. So strong fear of snakes, confidence went off, and warts over finger. Laccan. 10 1 dose, and all those 32 watts within a span of 15-20 days it just disappeared. Otherwise they were planning to burn it. Okay. So Laccan, dulcamera, natremure, anacardium, Causticum, you should remember. Now Barretta is also a remedy which has warts over hands. Sulfur, Barretta. See, warts over fingertips and around the nails. Top remedy is Causticum. But you also have 3 more remedies in your repertoire. And one is Tuja, nitric acid and dulcamera. Okay. Now we'll try to understand the character of warts. So I told you warts we'll be discussing under 2 headings. One is location, which we just saw, and the second important thing will be character. Any wild guess, what is the character of warts you have in Causticum? Or before you talk about Causticum warts, what other characters you are aware in warts? Huh? Warts can be pedunculated, piliform and cauliflower, flat warts, good, agreed, bleeding warts, painful warts, yes, good, warts which can itch, okay, warts which can itch. See, these are few characters, very good, absolutely right. Now, in Causticum, what is the character of warts? See, now this class on warts and Causticum has some meaning and relevance. Any case of warts, you can't prescribe Causticum. That's what I am trying to tell you. Matching the simillimum at the mental level and matching the simillimum even at the physical level is very, very important. You can't take anything for granted in homeopathy. Okay? So what you need to understand here is the warts, I've just taken it from the repertory and source book, warts which are hard, one of the 3-mark remedy. I should have asked you the other remedies, and I know one remedy would have definitely come up, and that remedy is antimonium crudum. Okay? Antimonium crudum. Now what is it that you have in antim crude? They also have callosities, hardness, hardening, thickness. So calcarea carb, sepia, silicia, sulfur. Pedunculated. Now what is pedunculated? There will be a small kind of a stalk kind of a thing, and then there will be an outgrowth. Okay? Pedunculated. Yes. So when you describe or when you are treating a wart, fine, when you are not getting other mental symptoms, when you are treating the symptom based on the local symptoms, then all these things will become very important. Where, what is the character, that will become very important. So hard bleeding warts, the warts which bleed, a better remedy will be nitric acid. Okay? Warts which bleed, warts which are jagged. Fine? Jagged means anything which is sharp, which is rough and which is protruding. So tomorrow you have a wart which is sharp, which is rough and which is protruding. Then you can look under the rubric warts jagged. Okay? You have Causticum. Okay? So one image I have taken from Google so that you can understand things better is, this is pedunculated warts. If you see here, there is a small stalk and then you have an outgrowth. Pedunculated warts. Fine? Hard warts, pedunculated warts, jagged warts. So this is what you have in Causticum. Okay. Now quickly, what remedies come to your mind for warts? So that we can take it up for comparison. From your clinical experience or from your theory that you have studied, other remedies for warts. It's a simple question. Okay, very good. Natriumur, Delcamera, nitric acid, ferrum picricum. See, ferrum picricum never used, but what is very characteristic in ferrum picricum is okay, combination of hardness of hearing and warts. But what is the character of warts? They are more pedunculated warts. Ferrum picricum. Rare remedy, if you get a chance, please do explore, nothing wrong. So, one remedy will be nitric acid. Okay? Commonly used remedy for warts. Now, what is it that you have in nitric acid? You can either look at the location or you can look at the character. When you look at the location, where do you have warts in nitric acid? We have covered few there, mainly over eyelids. Okay? And one dangerous area where you can have warts will be in the nostrils. See, we saw on nose, which was Causticum, and inside the nostrils, fine, the only remedy is nitric acid. Warts inside the nostrils, fine. And the warts which are pedunculated, warts which are soft, and warts which are bleeding. Okay. In contrast, causticum had more of hard warts. Nitric acid has more of soft warts. See, inside nose, only remedy. Warts over lips. I have a small case, way back, must be to one of the second year classes, I had shared this case. This boy had wart over the lip. I have the image before treatment and after treatment. And you know what do they do in allopathy is they burn. And lip, you know, is highly vascular. So generally they don't touch this. And that's how he landed up in my clinic. Okay. And this boy beautifully improved, meaning warts disappeared with lachesis. Fine. I'm not trying to tell you lachesis is equal to lips warts. But that case required lachesis. And he was prescribed lachesis and beautifully it vanished. Fine. Okay. So lips, warts over lips, you can think of nitric acid also. But that case did not fit into nitric acid. He or his symptoms were more towards lachesis. So he was prescribed lachesis. Fine. And another remedy, calcarea carb. I have taken only 3-4 remedies so that we can focus on other things in causticum. Now calcarea, as you know, is again a very psychotic remedy. A remedy in which you see many growths. It's a psychotic remedy where you see growth. Okay. Now, you see a lot of growths in calcarea. Like, you see mainly polyp. You see more of fibroid. You see more of cyst. Yes, lipoma, cyst. Fine. It's a very insecure remedy. Okay. Now, where do you see warts in calcarea? Few I have already mentioned. Warts over scalp. Okay. Then, face. Good. Hands. Fine. What is the characteristic thing when you talk of warts in calcarea? There's something very, very characteristic in calcarea. Warts which are blackish. Warts, the color, we are talking of the color here. The color is more of blackish. Okay, very prominent in calcarea. And another sub-rubric I got in your repertory is wart almost skin colored. Fine. Wart is almost like the skin color. Only remedy in our materia medica. Wart will be like skin color. And warts which are soft. Warts over cheeks, warts over chin, warts over bend of elbows. Warts over bend of elbows. Fine. So calcarea. Now one more remedy we can take up here will be dulcamara. Now dulcamara, where and what is the character? Dorsum of the hand, good. Location is absolutely fine. What is the character in dulcamara? Very good, good, yes, absolutely right. Flat warts. Warts which are flat. Warts which are flat and warts which are thick. Thick, large, thick and large. They will indicate when you have a person who has warts which are large and which are thick, you can think of dulcamara. It comes very close to antimcrude. But what is the word we have in antimcrude is warts which are horny. Horny warts. Okay? Horny warts. Antimcrude. Again in antimcrude, again it can be large, it can be hard, but it is more horny. Cauliflower like, and it is more horny. If you have warts over the ear, which is the remedy? Warts over ears. See, whatsoever years you have it in bufo, only remedy. That's why I thought I will just share it. It can be of some use in future. Whatsoever years, bufo, okay. Whatsoever thighs, medorinum. Whatsoever thighs. Whatsoever gluteal region or buttocks, whatsoever buttocks. The remedy is conium. And whatsoever palate. Again a very sensitive area. Whatsoever palate will be argentum nitricum. And where do you see what's in palladium? Palladium, I mean, palladium will have warts over knuckles. Okay. And if there are warts over toes, the remedy will be spigelia. Okay. See, warts over knuckles, you can also add sarsaparilla. Beautiful remedy. Warts on toes, you have spigelia and sulfur. Yeah, ears we spoke, palate we spoke, and buttocks or the gluteal region, we have conium. Okay. Any other remedies you would like to contribute? What's Netremur we all know, it's over the palm. Okay. Okay. Now, any questions in warts? Warts and causticum and few related remedies. Okay. Now we look at another very important characteristic, general, and that will be causticum is a very good remedy for burns. We have already touched this information when we spoke on ailments from. So what will happen in causticum? Huh? Very good, ulceration. Yes, Ilam. Ulceration. Then, only ulceration. What is that phrase? Never well since burns. From the time of burns, the patient is never well. And from Phobister had spoken of a point. Never well since burn, to the extent that the child has stopped growing. The child has stopped growing after the episode of burns, causticum. Okay? And gangrene, ulcers, delayed healing. You can think of causticum. What other remedies come to your mind when we talk of burns? As a comparison for a PG scholar, which are all the other remedies we need to think of? One is Cantharis. Good. Only Cantharis? Calendula. Very good. Yeah, Minu. Calendula. Good. Huh? Carbolic acid. Very good. Elam has a point there. Carbolic acid. Beautiful. 3 top remedies. One simple remedy. Huh? Okay, echinacea. Yes, could be. Echinacea I have not used. I have heard more in that septic state. You can think of echinacea. Fine. But I have zero experience with echinacea. Any other remedies? Echinacea, calendula, carbolic acid, Cantharis. Which is the remedy for superficial burns? Only when skin is burnt. The burn is not deep. It is just affecting the skin. So when you have this situation, the remedy is Arctica urens. Arctica urens. In your repertory, you have a rubric, burns superficial. Okay? And I was referring Lilienthal therapeutics, and there it says, when only the skin is burnt. See, these are all very practical things from the stalwarts. I have taken from the source books. Fine, and if you get a chance, you should try Arctica urens. Arctica urens. Superficial burns. Okay. Now we are also talking of Cantharis. Now when do we think of cancerous? One of the commonly indicated remedies in burns. When? When do we think of cancerous? Huh? Okay, when there are blisters, more than that, scalds. Scalds. Okay? Then, burning, good. See, there is something called as painful. Burns which pains. I will come to it after some time. You can think of cancerous. Okay? Scalds. And burns because of chemicals. Okay? Chemical burns. Cancerous can be one of the remedies. So, see, yeah, sorry, I forgot to mention about this. Where do you have burns in cancerous? Burns of eyes, meaning cornea. Now, can you give me some practical example? Okay, in lab, good, agreed. In lab, something has caused damage. It has burnt the cornea. Simple example is crackers. Crackers, common example. During Diwali, we see many of them having a bandage over their eye. Okay, fine. Some spark, something, some cracker would have done a damage. So there you can think of cancerous. Burning, burns of cornea, burns of lips. Fine, okay. Cigarette, some burns. Or burns of tongue. This must be something hot you have had. It's a very good remedy for scalds. Something hot you have had, burnt your tongue. Cancerous can be a very important remedy. Okay. Now, what does this painful suggest? Ilam. Huh? So, see, Aisha is absolutely right. Now, because she answered this question, there was something else I wanted to talk. But anyway, superficial burns. Good, absolutely right. So what is it trying to tell us? That the nerve supply is still intact. The nerves are not damaged. Superficial burns. When you look at the degrees of burns from your forensic medicine or from your surgery, you have different grades, burns. First degree, second degree, third degree, fine. So, we'll come to it. We are talking of urtica urens. We spoke of urtica urens where you have more of superficial burns. Okay, only remedy. Now, Meenu was talking about calendula. Surprisingly, when I was referring the source books and repertory, unconsciousness after burns. So after burns, if somebody goes into an unconscious state, the remedy is calendula. Okay? And the only other remedy that is mentioned, what is it? Unconscious after burns is opium. Calendula and opium. Now what will calendula do when given for a patient with burns? We all know that property of calendula where it will cause granulation. It will keep the wound clean. It will prevent pus. It will prevent infection and it will cause healing and it will cause granulation. Same thing you see here in calendula when you give it for burns. Now if it is because of radiation, common complaint, burns because of radiation, what are all the remedies? X-ray, radium brome. Don't forget radium brome. Radium brome, cadmium iode, cadmium sulf, radium brome, X-ray and fluoric acid. Now, one question I have for you. When do you think of picric acid in burns? You told carbolic acid. Carbolic acid is like causticum, never well since burns. Okay? And when the burnt area is ulcerated and when you have very putrid discharges coming up, there you can think of carbolic acid. Okay? There you can think of carbolic acid. Now my question to you was, when do you think of when do you think of picric acid? When do you think of arsenicum alpha? When do you think of picric acid, and when do you also think of arsenicum alpha? Burning so much? Burning so much, but better by warm application. Good. So that is arsenic. Better by warmth. Okay. Burns, better by warmth. Arsenic. And picric acid. Picric acid. See, one beautiful word it is mentioned in picric acid. Burns painless. So what do you understand here? As a PG student, that's why when Neelam told painful, she gave you that clue. Now it's easy for us to answer picric acid. See, painlessness in picric acid, in a case of burns, it implies that the burns in picric acid are deep. Okay? Fine? The degree of burns in picric acid is deeper to the extent that the nerves are also burnt, or the nerve endings are also burnt or damaged, that they don't feel the pain. See, so beautifully it is there. We just need to interpret. So how you can interpret better? When you have knowledge of your allied sciences. Otherwise it will become little difficult. So painless burns, meaning deeper degree of burns, is where picric acid is called for. Okay? So in this slide what we did was, we tried to understand the indications of causticum in burns, what are all the probable remedies for burns and their indications. Okay? So moving ahead, we have last one or two slides, and then we can stop. Even in cough, causticum has something very special. Any wild guess? What is that? That is something special in causticum. I can give you a small clue. It is got to do with modality. Causticum? Illa. No problem. See, wet weather, you all know, they feel better. No issues. Something else they feel better. Okay, more than inspiration. Cough, better by cold drinks. Cough, better by drinking cold. And cough also better in wet weather. Cough aggravation, dry cold air. Okay. Now cough better by cold drinks, which is the other remedy. Soap. Very good. Cuprum. You have only two remedies in your repertoire, which is so highly placed. 3-mark remedies. One is causticum and the other one is cuprum. Now having said cuprum, how do you differentiate cuprum from causticum? Don't tell me in cuprum it will be more cold. Okay, see, we'll limit to the character of cough. You have paroxysm. See, in cuprum there is more continuous cough. It is not so bad in causticum. Causticum will have irritation in throat and then they will have cough. Okay? But in cuprum, you know, the cough is so spasmodic, so continuous, they become cyanosed. They turn blue. That is cuprum. It's a very violent cough. Cough may not be so violent. And the chest in causticum is also very weak. Even if they have cough, they find it very difficult to expectorate. Expectoration also will be a problem in causticum. So irritation in throat causing cough, cough better by cold drinks. Okay. Now one last point, and probably we can stop here. What are all the desires of causticum? What do they like? We are talking of characteristic physical generals. So what are all the desires of causticum? A small clue, the desires are similar to calcareous phos and tuberculinum. Smoked, yeah, smoked meat, smoked food. So in India, for Indian population, all those tandoor things, fine, tandoori things, okay, that kalmi kebabs, or what is prepared with coal, those dishes you can take it as smoked meat. Smoked meat, hot dogs, you know this. Now in India also it's becoming very popular, hot dogs, fine. Hot dogs, smoked meat, and you also have ham, and bacon, B-A-C-O-N, bacon. Bacon is nothing but a dish prepared from pork, pig meat, okay, bacon, fine. Huh? Hot dog, oh, what is it? But I've seen the picture image, fine. Long bread tarah must be they have something, some filling in between. I just saw the Google image, but must be you have a filling in between, and with that bread kind of a thing. Hey, no. So I don't know the history why it is called so, but fine. So hot dogs, smoked meat, smoked food, cheese. They also like cheese. Okay. One very important aversion of Causticum is sweets. They have aversion to sweets. But the desires will, they come very close to Calcarea fos and tuberculinum. One more remedy which has desire for smoked meat is a carbon. It's a carbon. Creosote. Good. Creosote. Creosote, Calcarea fos, tuberculinum. Predominantly has a desire for smoked meat. Okay. And aversion is for sweets. So in today's class, we try to understand the physical generals of Causticum, started with warts, where in Causticum, what is the character, with few related remedies. Second, we spoke of burns. Third, we also spoke of desires, aversions, and of course cough. The last part that we can talk here is the constipation, which you all know is something very characteristic. And what is it? Can pass stools only while standing. Okay? Can pass stools only while standing. Very characteristic. We have discussed this in the last class. And the only other remedy we have in our materia medica is alumina. Don't forget, this thing should be there. It should be there in the tip of your tongue. Alumina, Causticum. Okay? Zincum has got a different position. Fine? So, when you are looking at the positions, there are different remedies. But what is very characteristic in Causticum is that standing. They don't sit. Okay. Yeah. Any questions? So that next class we'll try to focus on the mentals. Mentals, hopefully 2 classes we'll try to understand the mind of Causticum. Mind is not very much explored. We know only about injustice cannot support and sympathetic. But when you read the source books, you have a lot of information. Hopefully I'll try to prepare a note and prepare a PPT and present to you in a day. I'll try my best. Okay. So any questions? You're clear? At least what was spoken? Okay. Thank you.